So the vaccines are the safest and effective way to protect you from COVID.
Again, I think their data for making those statements is inaccurate, and that's the problem, right? You have to always question statements and look at the evidence on which those statements are based on, and clearly the evidence doesn't support that statement that I just heard.
Hydroxychloroquine has been shown by multiple very rigorous clinical trials to be not effective. It also has fairly nasty side effects as well, in that it can cause significant cardiac problems.
Yeah, because for one, hydroxychloroquine doesn't do anything, and that's been proven by better studies. I think there was initial hope that it might do something, and then it got hugely hyped by a president south of our border who was desperate to show some kind of win without doing a lot of work, and it's clear that it doesn't help. And there are a number of side effects with hydroxychloroquine that can be really, really bad. That's why even as an anti-malarial, people try to avoid using it unless they have to. So yeah, there's no easy way out with a couple of drugs that are sitting out on the shelf available. People are looking to try to make drugs that could inhibit this particular virus, and that may pay off in the future. But right now, the best choice is to get vaccinated and prevent you from getting infected in the first place. Treatment is an option after when that's ruled out. But getting vaccinated to protect you from getting it in the first place is preventive. That's perfect.
Even hydroxychloroquine, even in its correct use as an anti-malaria drug, has so many side effects that you have to think twice about taking that. And we've seen, and it's interesting, they even were using it in VGH when the study came out of France. The first study came out and said, oh yes, it may work. Then a lot of different places around the world started using it on their COVID patients, and they didn't see any benefit. Actually, the side effects of it were worse for the patient.
I think this is a good example where you have to be critical, because the initial data on hydroxychloroquine was actually promising. So this was, people really thought this might be a cheap and a good fix, because compared to this, because we know the side effect profile of this drug. However, people started looking more deeply into it, doing more clinical trials, and it showed that hydroxychloroquine is not as promising as it should be, or as it was initially thought. So and this is also a way how these things usually go, and I think this is very important, because then we realized, okay, this is maybe not the best drug for it. So it's kind of try and error, right? But you have to have a good way of trying it in a good clinical trial where people think a little bit whom to give, whom not to give, and then to figure out, is it really beneficial? And it wasn't deemed beneficial. There were quite a few drugs actually who were really initially thought to be very hopeful or promising, and which did not pan out to be good for COVID.